Hi there, my name is Madeleine Gearside and I am a Policy Officer with Carers New South Wales. I co-authored this presentation with my colleague Grace Cherrington, and the focus today will be the experiences of older carers connecting online, particularly during the COVID-19 pandemic. I of course want to start by acknowledging the traditional custodians of the land from where we're all meeting on today. For our North Sydney office, they are the Gorogal people of the Eora Nation. And I want to pay my respects to elders past, present and emerging, and of course extend that respect to any Aboriginal people joining today. Just briefly about Carers New South Wales, we are the peak organisation for family and friend carers in New South Wales, and our vision is an Australia that values and supports all carers. And in terms of our definition of carer, we consider a carer to be anybody who provides care and support to a family member or friend who has a disability, mental illness, drug or alcohol dependency, chronic condition, terminal illness, or who is frail aged. So our definition doesn't include paid care workers or formal volunteers or kinship or foster carers. It's really focusing on people who provide unpaid care to a person that they share a personal relationship with. And at the moment, we have about 854,000 carers in New South Wales. So this presentation will draw on 2 consultations undertaken with more than 80 carers and other key stakeholders by Carers New South Wales during the course of the pandemic, along with data from the Carers New South Wales 2018 Carer Survey and the 2020 National Carer Survey conducted by Carers New South Wales. And that data will highlight the experiences of older carers in connecting with peers, support services, and the people they are caring for, and the challenges for carers' mental health and wellbeing during the pandemic. It will also draw on Carers New South Wales' experience delivering a range of programs to older carers in New South Wales to highlight opportunities and challenges that we've faced throughout the pandemic. So in terms of older carers, many carers in general report feeling isolated as their caring responsibilities limit their full participation in social, family and community activities. For older carers, particularly those in long-term caring roles, a significant amount of social connection is derived through face-to-face contact. And this social connection is really important for carer mental health and wellbeing and provides opportunity for relationship building, respite from the caring role, and also peer support. The COVID-19 pandemic has impacted the usual methods of social connection, with most connection occurring online. And I think it's really important to start by recognising the diversity within the ageing cohort. So there are many older people who are very active in connecting digitally, and some even prefer it. And we've also seen some carers have experienced increased confidence and literacy to connect online across the course of the pandemic, and we'll touch on that. So in terms of the context, COVID-19 has seen obviously many changes. For us specifically and for carers, there was the closure or digitisation of health and social services, which saw reduced formal support for carers and their care recipients, increased caring responsibilities where carers were filling service gaps, and carers adjusting to new methods of connecting with services. Also, there was less access to peers and family and friends, and including the person they care for. So that resulted in increased isolation, stress of separation when they weren't seeing loved ones, and again, adjusting to new methods of connecting with these loved ones. Physical distancing measures implemented during the COVID-19 pandemic have increased carer isolation. So as I said, many carers were separated from the person they care for. Sometimes this was due to voluntary self-isolation due to high risk in relation to COVID, but other times it was the direct result of service and community lockdowns. And even as digital services and supports became available, some family and friend carers were unable to benefit, and that might have been due to entrenched digital access barriers, including limited resources to purchase equipment, low digital literacy, and also limited internet coverage. The Carers New South Wales Carer Survey this year was national in scope for the first time. And the survey was collected from carers across all states and territories in Australia. The survey focused on experiences of different sectors, including aged care, disability, health and carer support. Carer health and wellbeing was also a focus, carers' involvement in paid work, and also just the general characteristics of carers and those they are caring for. We received 7,735 valid responses to the national survey. And as I mentioned, carers came from every state and territory, but also represented different cultural backgrounds, different sexualities, ages, and also socioeconomic status. And what I really want to emphasise here is we saw very quickly that it's not just digital literacy and age and generation related factors that influence older carers' capacity to engage in online connection or digitalised services. We know that not all services are able to offer a high quality, engaging, accessible digital alternative, and some don't offer anything at all. Not everyone can or wants to engage online. It's simply not their preference. And we know that there are several barriers to prevent effective uptake of digital options. So that might include digital literacy and confidence, resources to purchase and upgrade adequate devices, resources to pay for internet quality, mobile and internet coverage being a concern, competition between household members where there's multiple people needing to access that device, and also a lack of space and privacy for accessing services that might include psychology or other things like that. So what I wanted to do today was report on evidence-based approaches undertaken by Carers New South Wales to support older carers to navigate more digitalised approaches. And we adapted a number of programs, both through our Carer Gateway service provision and through some of our peak activities and programs. So the Carer Gateway is a national initiative aimed at supporting carers through the provision of a range of online and in-person services. They're free to access for any carer, providing support to those, what I mentioned before, in line with our definition. The Carer Gateway provides in-person services through a network of regional Carer Gateway service providers, and we were successful in being a provider for New South Wales Region 4, which is inclusive of Hunter, New England, the Central Coast and the mid-north coast of New South Wales. Carers New South Wales Carer Peer Connect program is funded by the Department of Communities and Justice, and it provides an opportunity for carers to be linked with each other to give and receive peer support. So carers can share information irrespective of their geographical location, and it offers online support including chat forums, online learning modules, service promotion, and also an opportunity for carers to connect face-to-face outside of that online platform. So by building, in relation to the Carer Peer Connect program, which is one of our peak programs, by building on existing Carer Peer Connect programs that are typically delivered in person, Carers New South Wales sought to recreate these services into an online format. So carers were supported to transition to an online environment on a case-by-case basis, and it wasn't necessarily determined by age group because we didn't want to discriminate based on age. Carers were mixed in their response to transitioning online, and some groups just chose not to meet virtually because that was their preference, and of course we respected that. 70 to 80% of active carer support group members were able to transition to the online environment, and those who chose not to or were unable to were supported via traditional methods, whether that's phone calls or one-to-one support. And a large proportion of these members who were supported were over 55. So I've listed there a number of online sessions and resources that were developed, including facilitator meetups, online meetups that were more informal, online carer support group workshops, carer support group workshops focused on how to support other carers online, carer hangouts, which was just an opportunity for carers to drop in when they wanted to and have a conversation, more so for emotional support. And a video was produced about using Zoom, and there was a dedicated digital resources page added to the Carer Peer Connect website. In terms of the Carer Gateway in-person peer support program, this was rolled out in April of this year, 1 week prior to the lockdown in New South Wales. So as you can imagine, we very quickly transitioned from in-person to virtual support. There were support groups that were already being established by region, and a large number of those carers were over 65. Peer support sessions are intended generally to be quite structured and generally have a theme, but with the onset of the pandemic, IPPS staff were very flexible in their delivery and chose to be quite guided by the needs of the groups, and obviously social connection remained quite a priority. So IPPS developed a user-friendly Zoom instruction guide with photographs to represent the setup stages and the processes. They also delivered one-to-one Zoom tuition for carers and sort of facilitated a mock Zoom meeting. We saw some carers presented as quite anxious and reluctant in making the virtual transition, but with support, many transitioned successfully. We saw a number of carers concerned about poor Wi-Fi connection and being disconnected, and many carers, interestingly, expressed experiencing Zoom fatigue, and that impacted their engagement with it as well. We know that many carers were supporting their care recipient to connect online, whether for therapies, telehealth, social connection, and it left little reserve for them to want to do this for themselves. We also had informal drop-in sessions and catch-ups, and IPPS continued to develop those relationships through phone check-ins where carers preferred not to connect online. So in summary, COVID-19 resulted in sudden reliance on technology to socially connect. Opportunities have existed to improve inclusion, but we know that there are still those access barriers that need to be addressed for it to work well. Older carers already face a number of challenges, including socioeconomic disadvantage and social isolation, and digitalisation during COVID-19 certainly exacerbated these challenges. Carers' online engagement, emotional wellbeing and social connectedness can be improved by improving digital connection for carers. And we know that digital services can support carers, but that this shouldn't replace face-to-face services and supports necessarily. So finally, many technology-based programs for older Australians are often centred around digital literacy, aimed at building the capacity of older people to effectively use and navigate services that are becoming increasingly digitalised. But it's important to consider the diversity across the ageing population and understand the individual barriers to social connection that might exist for older people to ensure these barriers are overcome. And that's my reference list at the end. And thank you for listening. There's my contact details. Take care.